Hello, everyone. My name is Joseph Muller, and my presentation is on anxiety disorders in the United States. Anxiety disorders are the leading chronic mental condition in the United States. From 1990 to 2019, there has been over a 50% increase in the number of anxiety disorder cases from 31 million to 46 million. Anxiety disorders are also the second leading cause of disability-adjusted life years, with an increase of almost 55% from 19 million in 1990 to 29 million in 2019. Anxiety disorders can range in severity from mild to moderate and severe. Mild symptoms account for approximately 10% of adults in the United States, followed by severe at 3.7% and moderate at 3.4% of all adults in the United States. The highest prevalence of anxiety disorders is seen among those ages 18 to 29, which includes the typical age of onset, which is 21. In addition to this, those of Hispanic, Latino, race or ethnicity, and women are seen to have the highest prevalence when compared to their counterparts. Mental illness affects a quarter of the United States population, with the most prevalent condition being anxiety disorders, as previously mentioned. Anxiety disorders include generalized anxiety disorder, phobias, panic disorders, and social and separation anxiety, among many others. Some of the symptoms that accompany this condition include feelings of restlessness, extreme fatigue or tiring easily, having a hard time concentrating, being irritable, insomnia, and the most common symptom, excessive, uncontrolled worry. Some of the contributing factors of anxiety disorder include childhood shyness, nervousness, and traumatic life events or spending time in traumatic environments. Additional contributing factors could be having a family history of mental illness, thyroid issues, and the consumption of caffeine. One of the studies I had looked at suggests that the prefrontal cortex is the part of the brain that can become stuck on high alert and trigger automatic responses to normal everyday events and tasks, leading to the onset of symptoms of an anxiety attack. The most evidence-based solution to combat anxiety disorders are cognitive behavioral therapy and pharmacotherapy. Cognitive behavioral therapy is a form of talk therapy done with a psychologist that educates the patient on the disorder, as well as provides skills to confront the situational triggers and eventually overcome this barrier. The goal of this therapy is to decrease worry, stress, and fear through symptom management techniques employed by the psychologist. Pharmacotherapy consists of the use of selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors. These medications have been heavily evaluated and have actually replaced previous benzodiazepine medications for the most part. A Canadian comprehensive review brought to light the efficacy of the medications in addition to cognitive behavioral therapy, and had shown clinically and statistically significant results. In addition to these interventions, screening is another important aspect. The United States Preventive Services Task Force recommends those 8 to 18 years old be screened for anxiety disorders due to the increase in prevalence. Some of the community-based interventions include the Friends Initiative. This initiative uses trained teachers in elementary schools to incorporate cognitive behavioral therapy through problem solving, anxiety management techniques, and teaching children how to manage their emotions. This was analyzed in a randomized controlled trial with schools, as well as using healthcare professionals as the delivery method for the Friends Initiative. The results had shown greater decreases in anxiety when administered by healthcare professionals compared to school teachers. The initiative is also backed by the U.S. Preventive Services Task Force as a method to reduce anxiety. However, there is no statistically or clinically significant findings to back up this program. A 2023 article that I had looked at was a systematic review of 31 studies that provided exercise, music, and gardening programs to reduce anxiety. One of the programs looking at exercise was seen to be clinically significant, whereas the other 30 studies had shown decreases in anxiety. However, they did not show any statistically or clinically significant results. This was seen to be caused by a high attrition level as well as performance bias. Some of the recommendations would include funding for additional research into community-based initiatives. The Biden administration has increased funding for novel mental health conditions. However, it did not specify which conditions would be funded. With this being said, additional funding should be provided specifically for anxiety-related disorders due to the growing prevalence. In doing this, more randomized control trials can be performed using the ones previously mentioned as a starting point and build upon those, since they did show decreases in anxiety, even though they were not statistically or clinically significant. As of right now, the most evidence-based intervention to combat anxiety-related disorders is individual intervention through cognitive behavioral therapy and using pharmacotherapy. These are the only current methods that provide replicated clinically and statistically significant results when it comes to this type of disorder. Here are my references. Thank you.